us live right now. It's Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital, and we are heading into the late stages of the school season. Hate to say this, but fall sports is only a couple of months away. And, Joe, you wanted to go down the line of not necessarily fall sports, but getting the physicals done for the fall sports season.
That's right, Ray. I mean, frequently you ask, with very good questions, parents, grandparents of kids want to know when is the best time to get the physical done, and what is pretty typical for a lot of people, especially if they're playing sports for the next school year, is they'll wait until July 31st, and the first day of practice is August 1st, and then can't find a place to get a physical done. And waiting till the last minute is not ideal, because in checking people out for the sports physical, they're very frequently, 15 to 18% of the time, according to studies, there will be something we find that needs followed up. Not necessarily something that says they can't play sport, but needs followed up. So that's why the physical is done. If you go somewhere to get your physical done where they never have to look anything up, then you're not getting a very good physical done. So some of the things is you may pick up, for instance, that a kid's blood pressure will be elevated, and it needs to be checked a few times beforehand before we can be sure that that kid doesn't need to be treated for that or anything. Or we can pick up that a kid has a loose ankle from an ankle sprain that they never really rehabilitated well, and they need time to rehabilitate their shoulder or their ankle. Or we might pick up something like a hernia, very common on the physical exam, that needs to be seen by a doctor and perhaps even needs to be fixed in some situations. And so coaches are going to find out pretty quickly, too. If people wait till the last minute, not only are they going to have trouble getting into a practitioner to have it done, if they have one of those 15 to 18% of things that need to be rechecked, if those things are checked out later, it's going to go into August. It may go into the season. Coaches are not going to be very happy with that person on the sidelines. So the absolute ideal time is about 6 to 8 weeks before the season. And because most kids are finishing school this week or next week, a lot of kids are thinking about the sports physical now before school is over, and getting that done will give them a good jump on fall sports. So it's very important to do it now, Ray.
Joe, let me ask you this. What if you have, and this is new to a lot of parents, I'll put my hand up as well, with kids going into the high school side to participate. For the winter sports, do they get that physical done late summer, early fall?
You could get it done late. You could get it done now, and it's good for a year, so it would cover for that time of year. That's why we're encouraging this, and that a lot of the schools that we work with, we're going out and doing physicals this time of year. And we can do winter sport kids too, but ideally at least 6 to 8 weeks before. So for a winter sport kid, then that August framework, time frame is not bad at all. In August, September, not bad at all. But one other thing I wanted to mention about this, Ray, is this is also the time when we do the physicals that we're looking for that needle in a haystack. And what I mean by that is right now, you and I have had this talk before, there's a lot of debate, but it's not recommended that all 30 million kids in the country that play sports get an EKG or an echo test on their heart to see if they could be one of those kids with a heart at risk. But at the time of the physical, a well-done physical listens to the heart, listens to what symptoms or problems that athlete may have had in the last year, and if they have anything that makes us suspicious or concerned, they may need to have those tests done for sure then, and that may take 2 or 3 or 4 weeks to set up, and that's why that 6 to 8 weeks is so important. Remember one thing, Ray, that is so sad, and it happens here and happened in the last week since I spoke to you, a young man who was a freshman center from the University of Dayton passed away last week. He went home at the end of the school year from college, was playing pickup basketball. He was said to have an enlarged heart, and he passed away playing basketball. So the chance that we have of picking those types of things up that may put a kid at risk is done at a well-done physical exam. So make sure you're thinking about that physical. Make sure that your kid gets a well-done physical exam, and if there's anything that's questionable at all, have it checked out now well before the season.
Good stuff. Thanks, Joe. Good information for us. As always, we'll catch up with you next week.
Have a great week, Ray. See you.
You too. Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital with us.